All right, guys, Dani Williamson from Integrative Family Medicine, and this is Victoria Bailey with Victoria Bailey Thermography, Health and Wellness. Yay! Okay, we're so excited because tonight, it's Sunday night, and it's Sunday night service, right? So we are doing a live thermography session tonight on me. I'm so excited. Oh my gosh, it's going to be something. So we're going to switch gears over here in a minute, but last Sunday night, we had all education on thermography from Victoria, and it was phenomenal. And then tonight, we're doing a live thermography, right?
Right.
And you're going to do what?
I'm going to take the pictures. I'm going to show everybody exactly what the process is when you come into the office. I'm going to try to talk you through the images, which is what I do with clients, and kind of explain what I believe is going on.
Okay. And she's going to speak loud, because she doesn't speak nearly as loud as I do. I don't even need a microphone. You could hear me all the way to Nissan Stadium. So we're going to do that. As soon as you guys get logged on, hit your heart buttons, hit your like buttons, share it, because this is really something. If you're interested in thermography, if you've never done thermography before, this for sure will be educational experience. Yep. And if you have, it's going to be educational, because she's going to talk you through it, because if you've done it somewhere else, guaranteed you haven't done it as good as Victoria Bailey does it. It's a fact. She's the best there is. So she's got the state-of-the-art equipment, and we'll talk about that. And also, it's interesting because I did something I was not supposed to do. So tell us what you would not do before a thermography.
So before a thermography, you would not get a massage. You would not get acupuncture. You would not get a chiropractic adjustment. You would not start a brand new exercise program. You would not have something hot in your mouth for an hour before you come to see me.
Nothing hot.
Try not to wear any deodorant. I know if you have to, I can change temperature for that if I have to, but that's pretty much the rules.
No deodorant, but I had a massage, because you all know that the office retreat was at Gray Bear this weekend, and I had a massage this morning at 10 o'clock or something. So I don't know. We'll see what happens. And I got a pretty aggressive massage on my neck and my scalene, so it'll be interesting to see. But I can't help it. I was at Gray Bear, so I never do anything the way it's supposed to be done. Okay, all right, guys, we're so excited. Hit your heart buttons. Show Victoria some love, because I need to calm down, because you're supposed to be cool during this. You're not supposed to talk or do much action.
I'm supposed to bring your sympathetic nervous system down.
All right, I'm going to take deep breaths, and we're going to do this. I'm going to transition over here, and Victoria's going to talk us through it. And then when it's over, we'll come back right here in the front. Okay? All right. So Megan's going to stay. Don't touch anything. Yeah, we're ready.
We're ready.
Megan's behind the counter.
Zoom in on the
yeah, she can zoom in. So Megan, I have a brand new assistant. Thank you, Jesus, Lord. Well, I've never had one, so anyone would be brand new. So I'm so excited, and we don't even know what we're doing. Her very first experience with me is standing here with no shirt on at Victoria Bailey. So either she's going to run out of here and never come back tomorrow or whenever, or she's going to love it and say, okay, it can't get any kookier than this. But it can, Megan.
Right. Don't ever underestimate her.
All right, guys, we're going to get started. All right, Sunday night service.
So you're going to hang up your gown.
Oh, okay. Okay. This is not on. Correct. There
Are we
go.
ready to be
in.
on screen?
Okay. All right, talk to them.
Okay. So Dani is preparing herself right now.
Which means taking your clothes off.
Which means taking your clothes off in a cold room. So the first thing I'm going to do is I'm going to use Dani's head, and we're going to calibrate the camera, and I'm going to set it up for her, and then we'll proceed with getting real images. Okay. All right, Dani, hands on your hips, and that keeps air in the lymphatic system.
Oh.
Okay, so what we're going to do is we're going to do 6 images.
Okay.
So I'm just going to tell you how to turn that chair.
Okay.
And just try to stay as sitting up as straight as you can and not sway.
Okay.
All right, so as you guys can see, I'm gonna make this an artificial image just so it's a little easier for me to show it to you on the screen, and then we'll go back and fix it. So the white, which we're seeing down here in Dani's clavicle, some of this is lymphatic drainage, probably from her massage, so she kicked it up this afternoon, is typically the hottest, and then black is the coldest. So everyone's nose is cold unless you have a fever or your sinuses are draining. So you should be cold like a puppy, so your nose looks great.
It does?
It does.
Good.
So what we're looking at here is we have just a little bit of difference in the pressure behind your right eye than your left, probably a little bit of sinus from being down on a farm all weekend. So the dense tissue that we see here on your cheeks, it's a little black, a little blue. That is just where your tissue is denser. We'll see that in your breast, your belly, your thighs. Everybody has dense tissue somewhere. Okay, so that's pretty much how it works all over your body. So I'm going to change this back to real temperatures, and then we'll do real ones. Okay. So Dani, tip your head back for me. This lets me see your thyroid, her favorite subject. Okay, you can bring your head normal. Now I want you to do a 1/8 turn with that chair either way, because we're going to do both sides. Do you have a headache?
Nope.
Okay, because if it right over here on your left temple, it kind of looks like you have either an old headache or one that's coming on. It kind of looks like an old headache from the last couple of days. So if you all can see, and I hope my little X is helping, but right here we've got this line of 2 different colors of orange. These are those scalenes that Dani had a massage on today. So that's why they look a little bit upset with her, because she was rubbing on them. Okay, 1/8 to the other side.
The other side.
Yeah,
Okay.
and you can talk, Dani. You're allowed to talk, except what I'm doing in your mouth.
Okay.
So here's the other side. So 2 things I want to point out. Right here I had asked if you had a headache. Well, you've got a little congestion on the left side as well as the right side in the same place. So anytime there's something in your body, front to back, left to right, good or bad, if it matches, it's better. So the fact that you've got the congestion in the same place is just something systemically going through your body. You have a little bit more heat on this, the right side of this with the lymphatic system, which
I did have an aggressive massage today. Didn't even think about this.
Okay, well, there you go.
Scheduled it yesterday.
Actually, this is actually kind of good to show, so
Okay.
people can see that. So this is kind of the importance of telling me when you've had something done. Otherwise, I'm concerned, and I don't know if this is something that's normal. Is it something temporary? Is it something new? So it's really important. People like to not tell me things that they've had done. Sideways to the window, to your left. There you go. Turn your chin back to me just a smidge, right there. So you can perfectly see that muscle, Dani. It's a perfect line. So that's really cool. So this is part of that sinus or congestion that I was talking about. I can't see through your hair, but I can see it comes right here behind your ear, right down into that lymphatic system. And the lymphatic system will always be a curl as opposed to a straight line, and that's how I can tell what it is. Okay, back around to the door behind you where you hang your gown.
Okay. Oh, all the way this side.
All the way that side.
Okay.
Okay, and then to the back wall.
Guys, if you think this is interesting, hit your heart buttons.
Dani, tip your head forward just a little bit so I can see your neck. Thanks. Those curls are bouncing. So what I'm doing is every section of the body is a different temperature. So what I'm doing is I'm actually recalibrating the camera or adding different temperatures to it until I can get to what is the normal body temperature for that area. All right, Dani, let's flip back around to me. Is it time for an adjustment? Because your neck is out right here.
Yeah, tomorrow morning or
There.
tomorrow afternoon at 3:30.
Well, right there, if you want, right
What?
there is where your neck is out of line.
Oh.
So you need to get that adjusted out.
Okay.
And
Tomorrow,
then-
Dr. Justin Deering, 3:30.
Okay.
I'll be there.
Oh, well, tell Dr. Deering also you need to have your sinuses done. That's around C1 or 2. It's kind of out of my
Okay.
wheelhouse, but that'll clear up your sinuses.
Okay.
Okay, hands on top of your head. So we're going to go down and do your breast.
Great. Oh, Lord.
Things we never thought we'd do.
They're so tiny. Are you sure you can see them?
I'm sure I can.
Okay.
I will not run over your toes. That's funny.
All right, people, you all know I love you to do this live.
She
I mean,
does.
God forbid some sort of malfunction happens and it actually shows me live. Whew.
That is not going to happen. We're not going to let that happen. Okay, so what we're seeing is Dani is very unremarkable, and I love to tell women when their breasts are unremarkable because that's a compliment when you come
look
here.
At that.
Maybe not at home, but when you come here it is.
Okay.
So all of this blue, the darker, the 3 rings that we're seeing, that is all dense tissue. So that's where you've actually got some fibrocystic, some density going on in your breasts.
Mm-hmm. I've had 2 biopsies on the right breast, so that would be on our left, right there.
Yes,
yeah,
correct.
on the outer right.
And it's
lateral.
right here. Mm-hmm.
Yep, and
I
there's a
can see.
clip in one
There's
of
a
them.
marker.
There's a mark there. Mm-hmm.
Yeah, so
There's
this
clipping.
marker right here, I don't know if you can see that, Pat, but right here, this is where Dani has a marker in her body.
Right there.
Yeah, and so it's showing up cold because it's metal.
Okay.
So metal will always show up cold in the body. A little bit of lymphatic congestion,
Where is it?
right here in your clavicle.
Okay.
Yeah.
Okay.
So lymphatic system's a one-way portal. When I see congestion there, it's congested from the ankles up because it's
Okay.
like a drain. It's got to
Okay.
drain down. So, okay, 1/8 turn, just like you did with your head. So basically still we're just looking at the lymphatic system. Everything else is looking really good. Okay, other side. Okay, come back to me a little bit of that. Right there. Okay, sideways to the window. So all of this that I'm turning orange right now is all lymphatics. This is part of the lymphatic system, and so it starts here and it comes down, it goes all the way underneath the breasts and comes back up the center to the upper cisterna-chyli, which I'll show you later. And then you have 3 lymphatic systems that come together right here. So a lot of times, especially when you have your cycle, you complain that this hurts or it gets a little, you can feel a little lump or something there, and typically it's the lymphatic system clogging right there. Okay, back around, all the way around. Keep going.
Oh.
And then pull your right elbow back for me. Thank you for having good posture, by the way.
Oh, thank you.
Back wall, and you can let your arms hang down to your sides. So this is where I suspect we'll see some congestion. Look at that, we do.
You do?
Absolutely.
Where is it?
I'm going to show you. Okay, spin back around.
Okay.
All right, so
Ah,
here's,
look at that scoliosis.
Look at this crooked spot,
So
right.
you guys know more about me than most people do. I've got clips in my breast. I have scoliosis. Okay.
Yeah, you can see how crooked you are.
Yeah,
See
I
where your
am.
yeah, so.
And do you know who found that 20 years ago? Rodney Yee, the yoga instructor. When I was training with him, I was in a downward facing dog, and he brought everybody around me and said, look at her scoliosis. I had no idea I had scoliosis.
Roll those down for me just a one.
Oh, good girl.
It's okay.
Here we go. Okay.
Okay. So we're going to let your tummy cool just for a couple of seconds, just because you were sitting down, that's all.
Okay.
And even if you stand up, it still does that, just because the organs are there. So that clicking was you changing temperature.
Oh,
So,
interesting.
yeah, you just got a
Guys,
little cooler.
if you have any questions, post them up there, and Victoria can answer them tonight or tomorrow.
Right.
Okay.
Hands on top of your head. You still gonna say?
No, I'm postmenopausal. 1 year. I better not have a period. Oh dear gosh.
Don't blame that on me if you do.
Woo!
The flu I'll take. Anything
Yeah,
else?
yeah.
Okay. Okay. So this actually looks pretty good.
Oh look.
Now remember, so Dani is also doing
On day 4.
On day
Day 4
4
of the Metagenics 10-day detox.
So we would actually expect to see some organ inflammation because she's detoxing, because she's kind of making those organs angry to clean them out. They don't want to be cleaned out. So underneath the breasts right here,
Yeah.
that is lymphatic.
Okay.
And we know that because it goes up to the center of your chest, which is the upper cisterna-chyli, where it all flows to. So
Okay.
this is going to be your ascending colon. And you've got a little bit of something sitting right there, which is probably part of whatever you're detoxing out. So We go over here, transverse actually looks pretty good. And then this is probably lunch or something that hasn't moved that you ate today.
Okay.
Is what's sitting right there. Everything else actually looks pretty good.
Interesting.
So 1/8 turn. Turn your belly button back to me just a little bit, right there.
Mm-hmm.
So a little bit of pancreatic congestion.
Wait, let me see.
Okay.
Oh. Makes sense.
Okay, so go stand regular so I can set this. Yeah, and again, you're doing the detox. I absolutely would expect that. Okay, 1/8 to the other side. I lost you, sorry. Dani, come back to me 1/4 of that. Geometry this late on a Sunday. So this is, right here is some liver congestion.
Mm-hmm.
Again, you're detoxing, I
Well,
expect
this is
that.
a liver detox, so that
Mhm.
makes,
Perfect sense then.
wow.
Okay, sideways. Yep, there it is. I wouldn't be surprised if you don't have a little liver fluke sitting right there.
Mm.
Okay, all the way back around to the gown.
Oh.
Okay, and then to the back wall and let your arms hang down your sides. Pull them a little bit away from your body for me. Good job. So I wouldn't normally edit these images as I'm going along, but I'm trying to show people, so I'm going to do a couple of these. I won't do them all. We'll be here for hours if we do that. So I think you have a little bit of degenerative disc in your back. You can turn around.
I do. I mean, I already know I do.
Yeah, so I
Yeah.
think you have just a little bit, and I think it's sitting right here.
Yep.
So stretching is your friend.
Yes, it is. I was in yoga class today, and it was so tight. And when I taught yoga, I had, that was 20-something years ago, I had a radiologist tell me, you've got arthritis all in your low back, but I felt nothing because I taught yoga all day, every day. And I don't teach anymore, and I don't practice like I should. And today I was in yoga class, or in yesterday and today, so tight. You got to move. Your body is designed to move, people. It's designed to move.
Right, and especially you with scoliosis. I mean, you can see where your hips are, and they're even nowhere near each other.
Mm-hmm.
So for you, it's even more important, but you do have to stretch. Okay, Dani, give that chair a push.
Out of the way.
Just out of the way. All right, so we're gonna do, you can take a little step back, and I'm gonna do a half a body.
Okay.
So a little bit of air between your legs and arms a little bit away.
Air between your legs. There you go.
Well, it kind of goes along with come in and get down to your panties, which is our motto here, so. All right, so you can see that tummy. Most of yours is in that ascending, so that's kind of interesting. Look how much warmer your right leg is than your left.
Why?
Yeah, it's your circulation. I'm not sure.
Ooh, look at that.
Yeah. All right, turn around.
Isn't that something?
Yeah. All the way to the back.
Oh, I'll wait to the back.
I know, I got you in a pattern, then I took you off of it. So we're seeing this congestion behind the knees, which is exactly where we would have expected to see it. Again, with that lymphatic system backing up, we were gonna go clavicle, under the breast, under the arms, inside the elbows, at the inguinal, inside the groin area, behind the knees, inside the ankles. That's where we're gonna see all the congestion for the lymphatics. And you were spot on. So you're very compliant, Dani.
Yeah, I've never been told that.
Okay, you can turn around and face me. We're gonna do your legs.
Okay.
So I'm gonna do your thighs, your shins, and then your feet.
Okay.
I want to do the fronts, the backs, and then when you get to the side, a little bit of a lunge like that.
Okay.
So put your hands up on your waist just for the first image. I can't see it after that.
So she keeps talking, guys, about the lymphatic system. In a couple of weeks, we're going to do a live lymphatic drainage here, or lymphatic massage
right.
here. Yes. Which will be really neat because I've never had that done. So that'll be a brand new experience for me and you all.
Try and do the backs.
All the way to the back.
All the way to the back. Okay, and now sideways, Dani. Just a little bit of a lunge. It doesn't matter which leg. There you go. Good job. So again, here's the density I told you you'd see in your hips. Just, we all have it everywhere in those thicker areas. Okay, pivot around the other side.
Thicker areas.
Nope, nope, other way, leg, there you go.
I've never lunged with just my underwear on in front of a group of people in my whole life, ever. I've done lots of things in 53 years, but never. Poor Megan, she's going to have to go home and drink a whole bottle of wine.
Stand up, Dani.
Gosh, I can't imagine. That's my first job. It's my first day, and I see my boss with no clothes on. Look at the veins on that right leg. Now, I've had surgery on the right leg, vein surgery. So isn't that interesting?
Mm-hmm.
Not a bad surgery, but just have it, look.
Well, yeah, I mean, it's kind of interesting how high, and it was actually here and it trailed up, so we'll look at it the other way. And you can see it right there.
Yeah, look at that. So that's the vein.
That's the vein.
Yeah, I look at it every day. It's not pretty.
Okay, turn around, face back wall. Has to be pretty, Dani. It's part of you.
Aww.
All right, now sideways, and just sideways to either way, and just a little bit like this.
Larry.
Just so it doesn't matter. We're gonna do both sides.
Okay.
Doesn't matter. Okay, pivot around the other side.
Mm-hmm.
All right, you can stand up. You want to do your feet?
Yeah, sure. Okay, guys. So she's going to do my feet now.
I'm gonna need some props. So just give me just a second here.
All right. Do you have any questions? Anybody?
Anybody asking questions? Stand on here. You've been
Okay.
standing on the floor and you created some heat, so
Okay.
I'm isolating it. Is all I'm doing.
Okay.
So I can only see your feet and not wherever you stepped. Girlfriend, you got some cold toes.
I do have cold toes. I've always had cold toes. I have a perfect thyroid too. Like my thyroid, I just had my labs done last week and my thyroid works great, thank goodness. My T3 and T4 are perfect, but my toes have always been cold. Mm-hmm.
All right, step off of there.
Okay.
So you see the heat where your feet were?
Yeah. Oh,
That's-
look at that.
Yeah. So that's that'll stay there for about 45 minutes.
Really?
Yeah. So now I want to see the backs of your feet.
Okay.
Let's turn around and step on. So again, insides of the ankles, we're going to see some heat just where I thought we would because that's part of the lymphatics.
Oh. Does anybody ever have red feet? I mean,
Sometimes.
good hot feet.
Well, sometimes, but good hot feet could also indicate something not good. So-
Yeah.
Okay, you can step off of there.
Yeah, look at that heat.
Excuse me, I'm going to have to walk in front of the camera.
All right, guys.
Okay, I want you to stand here. You can hold on to this. I want you to, wait, this way. And I want you to do heel toe as much as you can.
You mean keep going back and forth? Or just...
Right now, just stand with your heel toe. There you go. When I tell you to, you can switch that one out.
Sorry, guys.
Sorry,
All right.
my bad.
Tell them what we're doing.
Okay, so we are going to take a look at your feet. Sorry. Yeah, you got some cold toes, Dani.
Aww.
All right, so in thermography, we don't care what's going on above or below anything. So it means nothing that your legs are turning white.
Oh, gosh.
That is not a bad thing.
It's not?
It is
Okay.
not. I only care about your feet.
Okay.
Okay, so Patty's going to change that pad that you're sitting on, and I want you to face the other way and put your left foot forward.
Okay.
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 All right, you can step off of there.
Okay.
Now we're going to have you stand behind the chair.
All right, people, what questions do you have? What'd you do this weekend?
Stand behind the chair.
Okay.
Is here. Put your hands down.
Okay.
All right. Sorry, this is a little.
So
going
talk
back
to him
and
about
forth.
price if we were
So we're
the
doing
full deal.
right now. We're doing a full body on Dani, and that price is $465. You just changed temperature. I'm waiting for you to cool.
I did?
Yeah. Yeah. We're gonna let you get.
I'm not as hot as I used to be.
You're not as hot as you
Oh,
used
man.
to be. And we just put it out there on the internet.
Daggone it.
Yeah, so this one is pretty much what we call the report card for the body. And if it can be done, I always suggest this to be your first one. Okay.
What do you mean your first one?
Your first scan. Put this
Oh, a full body.
underneath where her hands. And then we're gonna do your palms.
Lower?
Yeah.
Okay.
There you go.
So if possible, always do. Oh, look at that.
Yeah. Okay, you can.
Look at those cold
Yeah,
fingers.
you can move all of those. And Dani, you can have a seat facing sideways either way.
Okay.
And we're gonna do your arms.
Okay.
So you're gonna help him. We're gonna put this board under your arm
Okay.
like this, and you're actually gonna hold it.
Okay.
Okay.
All
So
right.
let her place that so that there aren't any fingerprints. It's
Okay.
okay. There you go. Yeah, arms are always a little bit harder to get done.
I've never done the arms.
No, you haven't. So what we're looking for basically is a relationship from the shoulder to the fingers. That's what we're looking at. See, like how hot your shoulders are. Some of that's from your yoga, and some of that is from your massage. And we're losing your little cold fingers. So there's no fingers for you today. So what I would say to you, Dani, is to pay attention to this shoulder, because you've got a hot spot right there, and I don't believe that came from your massage. So just pay attention to whatever's going on right there.
Okay.
Okay.
Touch the.
And we're going to spin you around and trade boards and get the other side. And then we'll be.
I'm not touching.
It's okay.
There we go.
And then this will actually be our last one. All right, we are done.
How's it look? That's not as bad.
It's not near as bad, no.
Okay, guys. All right, explain to him, tell him anything else.
Okay, so again, you've got the same thing on both shoulders, but not near as bad on
Okay.
the left one as on the right one. And
Okay.
some of this is coming from your massage, so
Okay.
some of this is not real. Definitely hands, we need to see what we can do about this circulation right here. Do we want to look over all of them?
Yeah,
Real
sure.
quick?
Sure. Let's take a look. All right, guys. Somebody says how go stand in front.
Yeah, just so I can.
Somebody was asking how often should you do this?
Annually, we recommend that you do this annually.
Okay.
It takes a second. I believe that you should start in your 20s. Some people say start when you're going to get mammograms, which is in your 40s, but I think that's a little too late at that point. But
a great baseline would be great to see.
Absolutely.
Right?
That's exactly what I recommend is let's get it done young so that we can pay attention to it. It's really what we need.
So I don't even know, do you know, when did thermography first come about? When did this start coming to the forefront for us?
So thermography started coming to the forefront. Well, actually, thermography itself is the same technology that we've been using in our armed forces for years.
Yes.
So
yes.
It's the exact same technology. But we've started to use it for other things like heat and air. I don't know all of those applications because that's beyond me. When we started using it in healthcare, it was in the 70s. It was approved as an adjunct in the early 80s for healthcare.
Okay.
So that's kind of where the history of it.
Okay.
That history goes a little bit depending on who you ask. There seems to be a little controversy of exactly when, but that's what I was taught and that's what I understand.
Oh, okay.
So, okay.
Okay, so what we got
So here we are. This is, as much as this took a little bit of time, this is actually a really good example because we're going to get down to about 40 images by the time we're done, but I have probably taken 90.
Okay.
So what happens is I will actually go through and edit these images when you're gone, which is easier than you to sit here naked freezing.
Right.
And I get
correct.
them the way that I want them.
Okay.
But in just looking at yours, again, your dental is really good.
Okay.
Your lymphatics are
Thank
really
you, Ryan Jones.
Your lymphatics are not bad. Your breasts look really good. Your tummy, again, where I think we're seeing the detox is what's going on.
Okay.
A lot of these kind of things are just going to get thrown away.
Okay.
I would definitely pay attention to this liver,
Okay.
which is what you're doing is your liver detox. And then
Yes.
this is the pancreatic side.
Okay.
They talk to each other, so that's what's going on there. Your veins look okay. I'm not an MD, but your veins look okay. They don't look like they're certainly not DVTs or anything like that.
Yeah.
And you already know that you have that history.
I do.
This is behind the knees. Again, this is that lymphatic congestion.
Okay.
That's sitting right there.
Okay.
There's not a whole lot more. I would say that I would pay attention to see if you're having a little bit of arthritis, maybe starting this left finger.
I have arthritis right here. Well, I had it for years. I don't have any pain at all if I don't cheat. If I eat gluten and dairy and sugar, then I have horrific pain here. The same pain I lived with for years before I was diagnosed with lupus.
Okay.
But when I cut that out, I don't hurt. I don't hurt at all. But the inflammation, it's still there, but I just don't hurt.
Okay.
So imagine, though, if I was eating, like I don't hurt at all right now because I've
Yeah.
had no gluten, dairy, sugar, soy, corn, eggs, peanuts, no red meat since Thursday.
Excellent. Okay.
Yeah.
And
so that's interesting.
Yeah. And so that, this is just exactly what we do. I just kind of go over all the images. We looked at the shoulders. We know that there's something going on here. So just do pay attention to this. And I want you to pull
Is that
this.
the front or the back?
This is actually right on the top of your shoulder.
Right on the top.
Closer to the front, right here. So, I don't know.
Huh. Interesting.
Yeah.
Okay. We'll see.
And only you would know if you did something to it. So.
Yeah.
And then other side is so much better.
Yes.
This one's definitely closer to the front.
Okay.
Okay. Any
Okay.
questions? Do we have any questions?
Is there anybody asking questions
How
on
much
here?
for the breast scan and how often should that be done?
Okay.
Okay. So how much for the breast scan and
Come
how
up here.
often should that be done?
Come
The
up
breast
here so I
scan
can
is
see it.
$235. Oh, sorry. Don't you love that?
Yeah, I know. I love this. I may have to go home with this one. I love this.
I'm gonna have to let you go home
Woo,
with it.
I love it. It's my favorite. Okay, so how much is the breast
The
scan?
breast scan is $235.
Doesn't matter how big they are.
Doesn't matter.
All the same
Yeah,
price.
right.
You don't get a discount.
And
Little.
or charged extra if they're large.
Okay.
And we do them annually. After your first one, though, we do recommend that you come back in 90 days and do a baseline. I don't know you. I don't know what your physiology is.
Right,
so
right.
I need to have a picture of what your normal is.
What do breast implants show up as? I just thought of that.
Yeah.
Can you see the implant on
So
there? How's
that would be
work?
anatomical. So I
Okay.
can't physically see the implant, but we can see if the implant is leaking. We can have an indication if it is.
Wow.
We can see it was actually colder
Okay.
So,
Okay.
depending on whether it's over the muscle, under the muscle, so there's some varying things.
Oh, wow.
But
Okay.
you'll definitely see it be a little bit colder
Okay.
with an implant.
Okay.
And when you do these scans, what do you do with them?
So the question is, after we do the scan, what do we do with them? So I work with a group of physicians. I will send your images and your history and physical down to the doctors. The doctors will give us their interpretation of the read, much like you would get with any other procedure,
Scan. Yeah, sure.
scan.
Yeah.
And then I actually send them to you. So the difference is you will get a copy of these. You'll get a copy of all the images, and you'll get a copy of the actual interpretation.
Mm-hmm.
So you'll have them for your records, you'll have them to take to your physician, whatever you want to do with them.
I'm going to frame mine this time and put them in the office. I didn't the last time, so I wish I had them actually. But we're going to frame mine, and they're going to be lined up in the office like they are in here. And at Teresa has hers up there. Mm-hmm.
So that means when you have one done in the following year, you can compare the two to see how there's any changes?
Correct. They're asking about comparison. Yes. So that every time you get a scan, it is compared to the last time. And your report will even say, it doesn't even matter if it's been 4 years since you've come back. It will say, comparative to 48 months ago, here are the changes.
Oh,
So,
okay, cool.
And what's really nice about the group that I use, that is the same doctor. So unless something has happened and they're no longer there, and I've only had that one time in about 10 years, you get the same doctor, which is really nice.
Wow.
Same person.
Okay.
Yeah.
Can you see vaccine injection sites?
Ooh, there's a
Yeah.
vaccine. And can you see vaccine injection sites? Goodness gracious, we're
Yeah.
opening up a can of worms.
We are. I'm gonna say
I don't
no.
know.
I'm
I
gonna
don't
say
have a clue.
no. Yeah.
I mean, I had vaccines. You know,
Yeah.
I was fully immunized, so
I would say no.
So then you can share these reports with their regular physician?
yes.
Yes. The
Oh.
question is, you can share the reports with your regular
Yes, because
physician.
they come to me too, so I know
Yes.
that they would go to a regular one as
Right.
well.
So we can share them. You can share them yourself. You're going to have them electronically, so you can do whatever you want with them.
Mm-hmm.
Any other questions?
And we will answer anything that you guys have asked as well, so when
Right.
we can look at the computer ourselves. But gosh, Victoria, thank you. This
you,
is
Dee.
great. So there we go. I need a little.
So what I'm going to do is I'm going to clean these up.
Okay.
What I call clean them up. I'm going to
Okay.
edit them through. I'm going to send Dani her final
Okay.
electronically, so you can post them
Okay.
online.
I will. I'll
So that
share.
we don't have all of the ones that we're going to throw away
Okay.
stuck in there. And
Okay.
then we'll lessen it. Yeah.
All right, guys. Well, thank you for bearing with us for our very first live thermography session.
Thank
and
you.
we think in 2 weeks
Yeah.
we'll do the lymphatic.
Yes, we'll do the
drainage.
lymphatics live.
Oh my goodness, lymphatic massage, and it's with these electrical wands,
Yes.
right?
Yes.
Oh,
They're
and you get to you're totally covered up, so it's wow,
Yeah.
that's going to be great. Okay, guys, all right, it's Sunday night.
Mm-hmm.
That means I hope you guys meal prepped for the week because tomorrow is Monday. So what time is it? 7:35. You need to go to bed early, right? Sleep hygiene, get your electronics turned off, right? Because we're finished now, so there's nothing else to see other than us. Get your electronics turned off, right? Make sure you get in your bedroom and it's electronically, clean in there and naive and all of that. You have a fabulous week. It's going to be a great week this week. Eat well, sleep well, move well, poop well, decrease stress, have community. Oh, can you tell if you poop on there? Well,
because the colon will be congested. Yes.
was mine good?
Yours was good.
Yeah, I know, because I pooped like a goose at Gray Bear this week. So that's, I was one of they feed you nothing. Nothing but vegetables there, so you can't help but poop. It's all you
we
do.
know you're not going to stick around now.
Poor Megan. Megan, come up here. Come up here. I want you guys to meet
Yeah.
Megan. So Megan is my brand new assistant. Here she is. Can you see her? Here she is.
Hi.
And literally tonight is the first thing. I said, Megan, I texted her tonight and said, hey, can you come and do this at 5:30? And she was like, yeah. And I was like, okay, I got to take my clothes off. That's no poor thing.
It was interesting.
I have needed an assistant forever and somebody to help me, and I think it's so snotty. Who the world has assistant but I need some help. You guys know I do. I need help with all kinds of stuff. So we don't know. We're going to build it. We're going to make it up together, aren't we? So anyway, she's either going to show up this week or she's not. She's going to say, no, I've had all I can handle, Dani. So
I've seen all I wanted to see.
baptism by fire. I mean, there's not much else you could see other than unless I did a colon hydrotherapy.
Yeah.
All right. So, all right, Victoria, what's your phone
Thank
number?
you. 615-934-3121.
All right, and it's Victoria Bailey.
Thermography, Health and Wellness.
That's right, Victoria Bailey.
Yes.
Thermography, Health and Wellness. She is the best there is. We appreciate you guys. We love you guys. All right, it takes
Bye.
a village,
Thank
man.
you.
Thank you, guys. See you next week.